Welcome to another One Girl Revolution conversation. Today I'm joined by Leona Hernandez, an I.C.U. nurse from St. Paul, Minnesota, who left her family and her life behind to go and serve those who were hardest hit by COVID-19 in America in New York City. She's working as an I.C.U. nurse in New York City during this difficult time, and so I wanted to have her on to share her own story, her own life journey. She talks about how she decided to become a nurse, how this decision came about to go to New York City and serve those in need during this difficult time, the sacrifices she and her family are making. She really brings a light to so many things that I've been thinking about, how much healthcare workers are sacrificing. Yes, it's their job. Yes, they're being paid to do this, but so many people are going above and beyond. And so I want to have conversations like this. And also their families. Their families are sacrificing so much. And Leona shares about her own family. She has 3 young children at home. And it's been a huge struggle, but she is doing incredible work, saving lives, and she will bring you so much hope, so much insight, and she will just be a beacon of light for you. We are going live with Leona Hernandez, a nurse from St. Paul, Minnesota, who traveled to New York City, left her family, her home, everything behind, to go to New York City to serve those in New York City affected by the COVID-19 crisis. So we're going to give her a second to join. Thank you everybody for joining. I'm really excited about this conversation. As many of you may know, One Girl Revolution has been hosting these Tuesday conversations. Sometimes we've done them on Wednesdays, but once a week we're trying to do these conversations on Instagram. So I hope that you'll join us. We always promote it. And I'm really excited to have Leona on. I see there she is. Let's give her a second to join. Thank you everybody for joining. Leona, you're just going to click the little button that says join, request to join this conversation, and it should link us. Hi, Erica. Hi, everybody. Thanks for joining. Let's see. Leona's having a issue joining. Let's get her. Hi everybody, we're so excited to have this conversation with Leona. We're having a little issue with her connecting. So she's on, I can see her, but I think she's gonna jump off and then hop back on so we can talk to her. But I'm really excited to hear from her firsthand experience on what's going on in New York City, everything that's been happening with the COVID-19 crisis. Obviously, all of us have our own experiences with it, but I'm really excited to hear from her. Everything that everybody she's working with, and she truly is such a hero. Up there she is. It's connecting. Yay!
Hi, Kate.
How are you?
Good. I'm sorry.
Oh my gosh,
The
don't
button
be
wasn't popping up
sorry at
on my
all.
computer. Sorry.
Instagram needs to get it together. It should be so easy, and sometimes it is, but I've had different technical difficulties with it. So anyways, I'm glad that you're here now. I'm so excited to be speaking with you, and I know there are so many people that are excited to hear from you and hear more about your story. And kind of a funny small world story that I think I said to you via email is I had heard about your story from different friends that either knew you from Minnesota or knew you from different things. And I didn't realize that I went to college with your sister. And so she had posted the story, and I was like, oh my gosh, like that, what a small world. So it's really awesome to be connected with you. And you've had I feel like you've had such a crazy couple of months, but even like a crazy week too, because there was a New York Times article that you were quoted in, or kind of highlighted your journey. So I'm sure that that's been crazy too.
Yes, that was because of the girl who's letting me stay in her apartment. It's kind of cool. We're both from Minnesota, but she lives in New York and is not here because of COVID.
Yeah.
And she's never met me. So we have a mutual friend, but she really just as letting a stranger stay here out of the kindness of her heart.
That's
So the New York Times article was highlighting her and then another situation that was similar in New York with someone really letting a stranger use their home. So very kind of her, especially because I'm working nights and I have some coworkers who have roommates. And in general, I would prefer a roommate, but it's really nice to not have a roommate when
yeah.
I'm sleeping during the day,
Yeah.
just because then I know it's quiet and I can sleep. So I'm very, very grateful to Hannah who literally gave her home to a stranger for 2 months. So
That's so awesome. And I love all those stories. I think all of us have seen so many stories or we've experienced people's kindness. But when I saw that, I was like, oh my gosh, what a hero. Like, what a hero
yeah,
she is, too. You know,
yeah,
honestly,
absolutely.
like, I'm excited to be talking to you because you are a hero working on the front lines. And I want to get into like what the experience has been like in New York and a lot of different things. But before we get into that, I'd just love to know a little bit about you, who you are
Yeah.
as a person, your life, your family, kind of where you're from.
Yeah, I'm from St. Paul, Minnesota, and I'm the youngest of three girls. Um, I initially wanted to be a special education teacher. Thankfully, my very first semester of college, they put me in a classroom, and I quickly realized that was not where I was meant to be. I admire teachers greatly, but my passion for working with children with special needs did not change. Um, but I really realized that that was not where I was meant to be. So I looked into physical therapy actually first and then decided on nursing. Um, as nurses, we don't really get to help children from a developmental standpoint, but we certainly get to care for many, many children and their families when they're facing either special needs from genetic conditions or from really the aftermath of needing critical care as young children. So I've really loved that. Um, my husband also is from St. Paul, and we have three little kids. We have a daughter who's 2, and then 2 boys who are 4 and 6.
Wow.
So this past year, I've actually been home full time with them, which has really been a privilege. I know that's just not even a possibility for many people, and that's been kind of a dream to be home with them full time. So that's been great. At the same time, I really feel privileged that at this time when there was a need specifically for nurses or for nurses obviously, but specifically for nurses with a background in an ICU, um, I'm grateful that I could kind of jump into this position and help our family at this time when my husband hasn't been able to work
Mhm.
because of COVID restrictions, but then also doing a job that there's a specific need for. So
Yeah.
grateful for that. And I think um, it's something that I think is kind of rare about nursing, um, like to have been home and then to jump into this
Mhm.
position,
Yeah.
and then go back to my family. So honestly, I ultimately I feel really pretty privileged to be able um, to take a job like this.
Yeah. Oh, that's
So
beautiful. Okay, so you have to tell me how did everything happen? Because I know for all of us, the COVID coronavirus pandemic like hit us all really hard and fast. And so I'm sure that even like this opportunity arose and it was kind of a whirlwind. Can you talk
yeah,
about that? Like even like the discussions with you and your husband, because I'm sure it was a
yeah,
huge sacrifice. It's and that's one thing that I want to kind of highlight as well is families are also sacrificing so much through this. So talk to me about like when you kind of started to decide to go to New York and that whole decision.
yeah. You used the right word. It was a whirlwind. Actually, our family was on a walk and saw one of our neighbors and friends, and like they were getting back from a walk, and she's a nurse in Minnesota as well. And I was saying, like, this is the first time in the past year where I felt like I really ought to be nursing. And so, like we were going into our homes and then jokingly, I don't know if it was her or me, but one of us was like, well, like, let me know if you are getting a plane ticket to New York, like as a joke. And then I think literally 48 hours later, accepted the contract.
Wow.
So it was fast. So I think it was the following morning after that walk. And I had been texting a lot of friends in Minnesota, either my old coworkers or other friends I have who are nurses. And a majority of them had been either furloughed or their hours had been cut already. And some of them were looking into trying to travel to places where there was a greater need. But some couldn't because they didn't already have experience in an ICU, and there just wasn't at the time a need for med-surg nurses. And to be clear, I think any med-surg nurse could work in an ICU, they just would need the training.
Sure.
So either for that reason or because their employers said, if you're going to travel, you have to quit this job. So that was tricky. In some ways, I understand where the employers were coming from. At the same time, it kind of seems wrong to tell someone like, you can't work, you can't get paid, but you also can't travel where there's an extreme need for you to be working. And I think that's really what made me think, I should have asked my husband before this if that's really what I said. I feel like that's what made me think like, oh, I have to go because my background is in an ICU and I'm not working right now. I don't have a job that I am having to quit that my family is depending on me still having or anything like that. So it really just makes sense. And my husband's home right now. So it's not like we have to somehow find childcare in the midst of a pandemic or anything like that. Not only are they cared for, they're cared for by their other parent. And so it just kind of made sense. What I didn't know is if I would be accepted. So I had also at this time talked to different people who either were travel nurses or who knew travel nurses. And then I also talked to someone who helped to set up one of the COVID ICUs in Minnesota. And all of them listed one of the same travel nurse agencies as a really good one to go with. So I just contacted that one travel nurse agency and I said, hey, I haven't worked at all in a year and my background is in a pediatric ICU. So I've never worked in an adult ICU. Is there a need? Like, is it even worth me applying? And my recruiter was awesome. And it was a fairly lengthy application and they did have me take a test. Like on ICU nursing, but then, like I said, 48 hours later, I had accepted it and we were buying the plane ticket and all of that. So, which I think is the sign of the times. Obviously, I'm sure they would have preferred to have someone who was currently working in an ICU rather than someone who'd been home full time for a year. Mm-hmm. And I did review a lot of things, but thankfully that hasn't really seemed to be an issue. Things have really come back. All right. I hadn't yet forgotten a lot of things. And so much of being a nurse, I think in any setting is assessing very well. And I think that's not like a skill or a job that you really forget how to do. Yeah. So that's been good. And switching from peds to adults hasn't really been too much of a shock, thankfully. Yeah. So that in and of itself, there are other things that are vastly different, but I don't think the switch from a pediatric to an adult world has been like an unsafe or an impossible transition, thankfully.
Yeah. And so that was mid-March that you went?
So that was mid-April. So I was in New York on April 14th, and then I started work on April 15th.
Okay. So when you got there, what was it kind of like? Because I think all of us, me being in Michigan, obviously Detroit had it was one of the hubs of COVID, unfortunately, but there's a lot of people just don't really know what it's like to be on the front line. So what was that experience like? You show up the first day, what was going on?
One thing that's different, I think almost everyone has been in a hospital in some form, whether for a very happy reason, like having a baby or visiting a baby, or for a not happy reason. One thing that was different right away is that all of the doors of each single patient room have had and continue to have all of the patient's identifying information on it. So name, gender, age, whether they have allergies, and then their past medical history prior to COVID, and then when they were admitted, if they have a breathing tube, when that was put in, all of that information, and then any continuous medications they're on, important lab values, things like that. So you literally walk through the unit and you see like this snapshot of everyone who's there. And families aren't allowed to come. So there aren't really issues with privacy because, I mean, in some sense, it is breaking privacy. Like in a normal world, I would never go into the chart of a patient I'm not caring for. So I am seeing information that I normally wouldn't see. Normally, I would only see that for my own patients. But it's not like we share those details with anyone else anyways. So that's different. One thing that's really hard is that I understand why there's a focus on preventing spread of the virus, but it does lead to some difficult issues too. Like in many cases, the providers don't go into the room at all, especially on night shift, which is just, it's very different. I'm used to working in an ICU, but I'm used to having other eyes also seeing and assessing my patient. So I'm used to the respiratory therapist being very involved and really being a lifeline for us nurses in terms of the respiratory status of the patient. And then I'm used to the resident or the nurse practitioner or the physician's assistant and the attending, like all of these eyes who are experts in this area, seeing and touching my patient in addition to me. And in many ways, especially on night shift, that's not the case. So I think through this entire time, the attending goes into each patient room once on day shift. But that's it. So in some ways, as a nurse, as a bedside nurse, it's a little bit scary because, like I said, I already felt like our main job was to assess and report and immediately notice changes and kind of determine what the patient might need. But in this case, it really does feel like the stakes are even higher to realize that really, in many cases, no one else is even seeing the patient. So that is a change. When I got here on April 15th, people were still using the phrase crisis nursing or crisis healthcare. When I got here, it was already better than the first 2 weeks when there really were just so many people pouring into the hospital. I've been able to work with some travel nurses and some regular hospital staff who were here during those first couple weeks. And it sounds like essentially on day one, they had only about a third of the I.C.U. staff that they really needed. When I got here on April 15th, I'd say in terms of nursing staff, we had about half the staff that we needed. So a lot of our assignments were essentially doubled from what they would normally be.
Okay.
But I mean, already by my second week here, it's been, other than some changes like less staff going into the rooms and patient information being on the doors and families not being present, starting about the second week that I was here, it felt more like a typical ICU in terms of the assignments that we had. And when I got here, we still weren't like turning and repositioning patients as often as we normally would, just because there wasn't time. We were really only doing one full assessment per 12-hour shift, which is not at all what we would normally do, again, just because there wasn't time. So that's was really sad. Obviously not the patient care that we'd want for anyone. But in terms of that, in terms of like nurse-patient ratios and providing the care that we all want to provide, that has that changed very quickly. And now, let's see, also when I got here on the one unit where I am, so I'm just on one ICU, but I don't think we had any empty rooms when I got here, and now half of the unit is completely closed. And they're trying to decide what to do with it. But we moved, all the patients were spread out more, and we moved all of them to one side so that we have one half completely closed and it's been deep cleaned and everything. And some of those patients have died, and some have recovered and gone on to rehab units. So even in terms of the number of people we're caring for, that's also changed drastically and pretty quickly since I got here. There were also a lot of literally the day that I started on April 15th, I was going to be on a different unit. And they walked me over there to meet the nurse manager, and she said, we were actually just notified that we're going to switch back to our pre-COVID status. So they were going to be a COVID ICU, and I was going to work there, and then they switched back to non-ICU, non-COVID, like literally that day. So then they put me on this unit where I have been instead the whole time. So, I mean, I think when things were at their worst, it happened, it sounds like literally overnight. And then I think, well, it seems like then things kind of also changed pretty quickly.
Yeah, that's what it
Over
seems
the
like a
course.
lot of places too. It's like it happened so fast. Hospitals weren't sure how they should,
Yeah.
they weren't prepared, or they weren't
Right.
sure how prepared they needed to be in so many places
Yeah.
too. Like in New York City, I know they had the different boats and like different options that
Yeah.
they're like, okay, if we have overflow, they did the
Yep.
same thing in Michigan and Detroit, where they had all these overflow places. And thankfully they haven't had to use those, at least in Michigan.
Right.
I know in New York
Yeah.
they use them very minimally. So
Yeah.
but it must just almost kind of feel like, especially working in the healthcare field, and for you to like show up, not know what to expect. I don't think anybody
Yeah.
really knew what to expect on a
Right.
day-to-day basis. Hospitals didn't know what to
Yeah.
expect because this is unprecedented.
Absolutely. Absolutely. I mean, to be honest, I was preparing for like 8 weeks of hell. And I mean, I literally was telling myself, like, I think I can survive anything for 8 weeks. Like, that's honestly truly what was going through my mind.
Yeah.
And I'm a little shocked, and I'm still uncertain what I have 2 weeks left here, and I'm uncertain what the last 2 weeks will hold. But um, I'm shocked and obviously grateful, not just for myself, but for the whole situation, that it's largely actually been a pretty positive experience. Because partly because I have seen people recover, and I didn't even know if that would happen. I didn't
Mhm.
know if every single person in the ICU would pass away, and if that's literally all I would see my entire 8 weeks here. So even seeing some people recover has been huge. And then another positive thing, with very few exceptions, it's really neat to see how well people work together. And I feel like in the ICU that I came from in Minnesota, for the most part, all of us were more similar to each other in terms of age. And a lot of us were from Minnesota, or at least the Midwest.
Okay.
A lot of us either were thinking we'd have kids in the next few years or had young kids. And there were just a lot of similarities for the most part, obviously not among everyone. And here, that's not the case. So many of us are from all different places across the US and just have very different backgrounds in terms of nursing and our personal lives. And it is really neat to see, like, oh, like we know how to do this. Like when, whatever room is busy, room or rooms, like people know how to help and how to step in and what you need. And it's neat to see people from such different backgrounds kind of use that similar language and really rally around whoever needs the help for the sake of the patient, but really helping the staff member who's in there, like the one nurse directly caring for the patient. Like the other staff is really supporting that nurse. So
Yeah.
so that's neat to see and encouraging. And so one thing that NYU is doing that I think is really great is they're having a lot of the travel nurses orient their med-surg staff to become ICU staff, so
Oh,
that
cool.
if they have another really large number of people coming in, that they'll have more of their own staff to help. Because I think, well, ultimately that's where the shortage ended up being is in staff. And so the nurse who I'm working with, she's doing a great job learning everything, but she was saying there's so much like just kind of expectation that what to do, like how to help this person, and they know how to help you. And I think that's very true. And it's neat to see that, even though we're kind of all thrown in, and it's not like we all had like a happy hour to get to know each other or anything like that.
Yeah,
Like
there's no time for
really
that.
just thrown in, start working.
Yeah.
So that's a hopeful thing.
Yeah. Well, I think everything with regards to COVID, it just has changed our whole world. It's changed how we even like, I love what you were sharing just about how like the hospital staff, it's like we're a team. Like we have to get through this together. And
Yeah.
even your patients, it's like, all right, we're in this together. Like I need you to pull through. I need you to get through this.
Yeah.
And I think that's everybody is like if we look for those opportunities, so many people have bonded together. I love
Mhm.
seeing all these positive stories of people just doing acts of kindness or supporting somebody who is in need or doing nice things for healthcare professionals because you really are sacrificing so much. I know it's your job and like that's the thing is like, yes, a lot of us have jobs that it's like you're kind of drinking through a fire hose at different points in your lives, but this is so
Right.
unprecedented. And so I want to ask you, what can people do for healthcare professionals in their family, their friends? Like, what are things that might support you guys during this time and even and beyond? Because that's the thing is like, I think there are a lot of people, we all obviously, like you said, have been to the hospital for positive things or negative things. And I think that it's cool for us to find ways to give back to the staff.
Yeah, that's nice of you to ask. Um, I will say that many people back in Minnesota have been so kind to my husband and children, dropping off meals or having meals delivered, and even like fruit or snacks, like things that my husband can quickly feed them, and also Lego sets to keep our boys occupied because they love those.
Ah,
Um, a little worried they're going to start getting spoiled, but um, that has actually been huge for my mental health to know that they're kind of being cared for in that way. Um, so that's definitely one thing. I think if staff has loved ones who normally would have them around, kind of reaching out to them or seeing if there's something that can be done for those people, um, whether it's children or an elderly relative or friend who depends on them or something like that. Um, Especially at this time. Like normally you still go to work and come home and are with your family, but at this time when so many people are away from their loved ones.
mm-hmm.
Um, and then um, texts are awesome, and also understanding if we don't reply right away is also awesome.
Or if you don't
At
reply at
least,
all, I feel like
right?
everybody is like drinking through a fire hose right now. And so even if
Sure.
there's times when you don't hear back from somebody, it's so important. Or like I was telling a friend recently, I was like, you should just call
Yeah.
and leave voicemail messages. Cause like I'm sure that
Yes.
people who are either first responders or healthcare workers, like they want to hear from people and they might not be able to
Yeah.
call you back like usual, but just to know that
Right.
they're loved. And it kind of breaks up your cycle too, because
Yeah.
I'm sure there are days that have been really difficult and then
Mhm.
other days that are kind of more normal.
Yeah. Yeah, that's exactly right. And Kate, I think that's a great suggestion about voicemails. You know the Marco Polo app?
Yeah.
That has been huge for me. Like my sisters and mom, and then a few close girlfriends have left messages on
Aw.
that. And I think at some point I reply to everyone, but it really is a gift to just like see people's faces a little bit or hear their voices and hear what they're doing. And um, so, yeah, and I think that's kind of similar to a voicemail where I could even like listen as I'm falling asleep, like even if I know I'm not going to reply now, but I can eventually. And so yeah, that's been huge. And some people have sent really thoughtful small gifts, which also does mean a lot. I don't think that spending money is a necessary thing, but those things do mean a lot. I mean, I think most people like either caffeinated pop or coffee. I feel like all of us, and there's a lot of caffeine on the floor.
Yeah. We need
So
it.
I think sometimes those practical like gift cards or things like that can be really helpful. But I certainly don't think that spending money on something like that is necessary. Those messages really do mean a lot. My sister has sent a card, I think almost literally every day that I've been here. So sometimes
Oh.
I'll get a few at a time, like on a different day. So that's huge. And sometimes they're like funny and witty. Sometimes they're just kind of telling me what's going on. And but again, I like no one needs to feel like they need to be that dedicated to sending that many. Other things that have meant a lot, a couple friends, kids, like young kids, have sent letters that are really beautiful and just little. My one little goddaughter, she's 6, and she sent me a letter that said, "What did she say? Thank you for fighting the sickness and for being my godmama." And that's all
Oh,
it's so sweet.
but it's
Like
little
little
things
things
like
like
that.
that mean a lot. Yes.
And so many kids are at home from school too. And so
Yes.
it's like, all right, well, now it's, I think, technically summer break for most kids, anyways, but it's like,
Yes.
we should all be doing little things that we can. And if your kids are home, like color some pictures and send them
Yeah.
to the local hospital or nursing home, or, think outside the box of people that
Yes.
might just need something. It could be from a total stranger, because I'm sure you've
Yeah.
also gotten some of those notes or messages from people that are total
Yeah.
strangers, and it just feeds your soul.
Yeah, it really does. Especially hearing like the way that kids say it, like for taking care of the sickness. And of course, right away I'm like, I wish I was actually taking care of the
Yeah.
sickness. Like, get rid of this.
Trying.
But just hearing like from the mind of a child is really, yeah, it's life-giving. So
Yeah. So
yeah,
you get to go home in 2 weeks, right?
2 weeks. Yes. So I'll have a test for COVID right after my very last night shift. And as long as it's negative, I can go home to my family right away. So my flight is scheduled. If it's positive, I truly don't know what I will do. I probably will go stay in a hotel room and order food for 2 weeks and not see anyone.
Yeah.
But I'm
Sleep,
really, really hoping
probably.
it's
Sleep.
negative. So yeah, right. I probably could sleep for 2 hours. But hopefully it will be negative and then I'll fly home right away.
That's so
So
great. That's awesome. Well,
yeah.
I'm sure your family is going to be so excited to have you back. And yeah, I'm just so grateful. And I know so many people are so grateful for everything that you're doing. And I'm just grateful for you sharing your story on here too, because it puts a face on all of our healthcare workers. We need to hear from everybody. So thank you for representing them. But I just want to ask, like, you shared a lot of different things about this whole experience. What was like what's been the most difficult thing, but what's been the most positive thing out of this? Kind of both and.
Yeah. I think the most difficult thing for me, and I think for a lot of the nurses who I work with, is that um, nothing seems completely black and white in terms of solutions. Like, kind of like what I was saying earlier with we want to prevent spreading the virus, but because of that, we have such huge restrictions on families visiting. And um, I do think that that leads to a lot of problems. Um, I really don't think people are meant to be in a hospital without anyone besides the healthcare staff advocating for them. And I certainly am not putting down my coworkers. I think we do see our job as advocating for those who are in our care. But also, they're not our loved one. And so, as much as we want to look on them with the dignity that they deserve and care for them in every way we can, it's just different. They're not our spouse or our grandparent or our child. And I I think that that can lead to problems, and that's hard to see. The one time we let families come is if the providers determine that death is imminent, then there's a certain chunk of time when families can come, one family member at a time.
Mm.
And we give them an N95 and a face shield and everything. And just this last week, they opened it up a little bit where instead of just that one chunk of time on one day, they can come for a certain period of time, like every day until that person passes away.
Oh.
Um, so I think that's a little bit better. But it's still hard to see that like we're not letting anyone come unless it gets to that point.
Mm.
So prior to like there's so many decisions being made by the family members when the family members can't come and see anything, and they get one phone call per 24-hour period, and that's it. So that's hard to see. Um, yeah, that's probably the hardest thing. There's always kind of a nagging like, what is the solution? Is there even like a great solution? Obviously, some things can be handled in better or worse ways, but
Mhm.
I think at least my brain kind of wants to find like this is the best solution and path. So let's find it and follow it. And
Yeah.
nothing really seems that cut and dry.
I think
Um,
like the uncertainty of all of this has been probably the most difficult thing for everyone,
yeah,
because
yeah,
it's just like nobody, and there's no clear answer for how to fight this. And so it's just kind of, you're going with it one step at a time. So
Yeah. Yeah. So that's hard to like see that in those really like critical situations.
yeah.
Um, I think the most hopeful thing, it's hard to pick. I mean, one hopeful thing is seeing that some people, and the unit where I am is really all elderly people with underlying conditions.
Okay.
So to see even those people in like the highest risk categories improving is huge. Like just to
Mm,
know that some people are, even after needing a ventilator and everything, are still recovering. Um, so that's huge. Um, and I think the other hopeful thing is seeing that I think by and large, people are ultimately wanting good things for each other. Um, for the most part, obviously there are exceptions,
yeah.
unfortunately, but I think for the most part,
Right. For the most
um,
part, yeah.
you
It's
know,
changed. It just has changed the way that we look at one another, I think, in all the different areas of our lives. And like we want what's best for one another, and we don't want to see our neighbors get sick, and we don't want to
right.
see. And I think for you, probably being there and serving, you see these faces of these people that you're working with, and it must kind of, it's like your own family. They kind of become your own family when you're working
Yeah,
with them. So that's got
yeah.
to be hard. But there's also like a positive when they recover. I saw
Hmm.
different things, and I don't know if your hospital does this, where they play different songs or bells or different things when people recover.
Yes,
So,
yes. I don't honestly know if we do, which is kind of sad. Like we
but I
don't
think it's
when
cool. Like it's
it
cool
is.
when
It's
people
very
have done
cool.
that, or even
It's
like
very cool.
neighborhoods where they drive
Yeah,
around and they honk their horn when somebody comes home, and like it's
yeah,
so beautiful to see people celebrating these lives. These
yeah,
people who have come through hell and back. Because I
yeah,
know, I mean, obviously I haven't had COVID, but I know from what I've seen, what I've read, like it's just so traumatic for people to go through it, and so it's incredible when people come through.
yeah, absolutely. I know we don't do anything special when we transfer people out of the ICU, and we maybe should, but I'm hoping we at least do something special when people actually go home, like when they're discharged
Mm,
from the hospital. But
yeah.
no, I mean, I've been fortunate to actually transfer people out of the ICU, and it's awesome, but it's really without fanfare. It's just
Yeah.
here we go. You're doing great.
It's
Like
the struggle of everyday
great
life.
that we're talking to each other. And yeah. So maybe I should have been implementing that, but no, we haven't we haven't played anything
Well, you
special.
have 2 weeks. That can be your that
I
can
have
be your
2 weeks.
parting
Yes,
gift. Is like
yeah,
implement that. But now
exactly.
we might, yeah, now we might not have to have it. But like I know
No,
things are changing so fast, and so it's like nobody
yeah,
really knows what the summer's going to look like with
right.
regards to COVID or what's going to happen in the fall. But
Yeah.
would you go back to New York City if, say, COVID spikes again in the fall?
Um, Probably not, only because I think at that point I would choose to stay closer to my kids.
Okay.
Um, I think being away for 8 weeks when they're this young is already quite a bit. If if Minnesota is really struggling in terms of staff, I think I would very likely take a position there.
Mhm.
Um, and I wouldn't say absolutely not to coming back to New York, but I think if it was still in the same year, I'd probably say no, just to not be away from them again in the same year.
It's such a
If
big
they were
sacrifice for families
older,
too. Yeah.
yeah. And if they were a little older, I'd maybe feel differently, but I think, I need to weigh that as well. So I think there's a good chance I would do something temporarily in Minnesota, because I wouldn't have to be as far away from them. But
Yeah.
um,
Well, I'm so grateful for the work that you've done. I know it's just a huge sacrifice, and I'm so grateful to your family. And I hope that
yeah,
your story just encourages people who are watching this and who will see this later, to think about the healthcare workers that they know, but also to think about their families. What can we be doing? And you shared some great things that we can all be doing to support these families during the time of COVID, but also beyond, because there are so many people that go above and beyond more than what they need to do. So
yeah,
thank you so much for sharing your story, and
yeah.
thanks for being on. And for people that are watching, if they want to follow, I know you have an Instagram. Do you want to share that? If
Yeah.
people want to follow your story.
Yeah, if people want to. It's Leona Mary, Leonamary. I'm
Awesome.
not an influencer or anything exciting, but yeah.
Everybody wants more authenticity on social media. So they can follow your social media to follow your journey and see more about your life and your family. But thank you again for coming on. I'm so excited
Yes,
to
thank
share
you, Kate.
this with everybody. And yeah, thank you so much for all you're doing.
Yes, I love what you do in all of the different areas of life that you touch on in all of your interviews. It's
Oh,
awesome.
thank you so much. Well, I'm excited to add you to that. So this is awesome. Every woman is a one girl revolution, and you truly are. So yeah, thanks again for joining, and I'll talk to you soon for sure.
Awesome. Thank
All
you.
right, thank you.
Yep.